the main issue is whether the patient is potentially curable or not. So as opposed to most solid tumors, some patients with metastatic colorectal cancer are curable. And certainly with liver metastases, that's the group that has the best chance of being cured. So the first decision is, what are the goals of therapy? How aggressively can we treat the patient? And then squaring away sort of what the ramifications of different treatments are. And part of the problem is that there's enough uncertainty or enough confusion in the literature that it's not a clear path. For example, you have FIRE3, which is a study that shows the benefit of cetuximab with chemotherapy versus bevacizumab with chemotherapy. You have 80405, the study that we did with SWOG, that shows no difference. Then you have a study called New Epic, where in patients who had potentially resectable colorectal liver metastases, they did worse if they received cetuximab, even though they were all RAS wild type. So these things don't square. There has to be some other way to figure this out. What we think we will see, and we're hoping to have this at ASCO fully defined, is that there are subtypes of molecular subtypes of colon cancer that a number of people have sort of guessed at or let's say have speculated about, and we think there are at least 4 such subtypes. And what we will see is that some of these are overrepresented on the right side versus the left side, and that in fact that probably does explain much of the biological difference between right and left. I mean, the mystery we have to settle is, why would all RAS wild type tumors on the right side not get any benefit from cetuximab? It does not make sense intuitively or otherwise, and we have to try to figure that out.